everyone, my name is Marcos Enoch, and today I'm going to show you, or I'm going to demonstrate about the immediate newborn care. Okay? First thing we have to do is to wash our hand and prepare needed material before we're going to prepare needed material. Before we beginning any patient care treatment, wash your hands and gather the necessary supplies. This is important for infection control, patient safety, professionalism, and maintaining a clean, orderly healthcare environment. Properly identifies infant name through the band or wrist tag. Based on the maintaining a high standard of care, being open with the patient and prevent medical errors. Enhance infants' comfort by keeping the environment warm. Infants are less able to control their body temperature, making them more sensitive to temperature change. The provision of a warm atmosphere aids in preventing hypothermia, a condition that can have detrimental effects on the baby's health. Wash hands before putting working gloves. Highly ingrained in the maintaining a sterile and clean healthcare environment. Patient-provider safety, protocol adherence, and infection control. This procedure is essential for keeping the norms of the professional healthcare and guaranteeing the best possible service for patients. After donning gloves, weigh the newborn correctly. It is important to precisely record a newborn's weight so that their growth and development may be evaluated. Precise weight measurement might reveal a lot about the infant's health. After that, we're done weighing the baby. Now it's time to cord dressing. Due to their underdeveloped immune system, infants are especially prone to illness. The application of cord dressing stops bacteria from infecting the held cord stump. Put the sterile gloves and properly restrain upper and lower extremities on the newborn. Movement and reflex control are not fully developed in newborn. Proper restraints aids in preventing sudden or erratic movement that can endanger to the newborn or obstruct the medical procedure. Using the OS with alcohol or ROH, disinfect cord 3 times from base upward. Place the sterile OS of the base of the cord and clamp the cord with umbilical clip 1/2 inch from the base of the cord. The risk of infection is decreased by clamping the umbilical cord close to the base in order to stop bacteria from entering the baby's bloodstream. Leave a tiny part of the cord intact. Cut the cord about 0.5 centimeter above the cord. clip that expresses the remaining blood from the cord with the OS. Place the base of the cord, brush of the cord. Cutting the umbilical cord around 0.5 centimeter above the cord clip, then using the oropharyngeal suction to express the remaining blood from the cord. Place the OS at the base of the cord stump. Pour 70% of alcohol over the cord. Next is I'm going to inject a vitamin K. This is based on the preventing bleeding problems, making sure the method of the coagulation is working properly, and advancing the infant's health and well-being. We draw the exact amount of vitamin K from the ampule and inject into the middle third lateral aspect of the infant's thigh. When compared to other parts of the body, in babies, the middle third of the lateral portion of the thigh typically has a greater and more developed muscular mass. The vastus lateralis, a muscle that allows for optimal absorption and distribution of the injection material. Make a good target for injection. After we've done giving a vitamin K for the newborn baby, carefully gets the anthropometric measurements of the newborn, starting with the head circumference, chest circumference, and abdomen circumference, and also the newborn length. This built on accurate assessment, tracking growth, and delivering the right care. The promotion of the neonates' health and well-being, as well as the making of well-informed medical decisions in neonatal and pediatric care settings depend on the practice. Now, after that, take the newborn's temperature rectally. One of the most reliable techniques for determining core body temperature is rectal temperature measurement. It gives a trustworthy indicator of the infant's internal body temperature, which is crucial for a precise diagnosis and the selection of the most appropriate medical treatments. After all that procedure, now let's begin the initial bath. After birth, the skin of the newborns may still contain remnants of the amniotic fluid, blood, and vernix, a waxy material that covers the baby's skin in the womb. By bathing them, you may improve their hygiene by cleaning their skin and getting rid of these impurities. During the bath, gently stroke the baby's skin can increase blood flow and encourage the growth of healthy skin. Holds the newborn in the football grip manner, folding both ears. Carefully wash newborn's head with the use of baby soap or mild soap or shampoo and wipes dry. Thereafter, puts on the newborn's diaper, shirts, mittens, and booties. Wrap the newborn securely with clean blanket. Place the newborn on the crib with drop light on and attach crib tag. Application of the cribs Prophylaxis, applying on the antibiotic ointment or silver nitrate solution helps to eliminate all or stop the growth of microorganisms that might have entered the infant's eyes after delivery. The gonorrhea-causing bacterium, Neisseria gonorrhoeae, is a particularly worrisome pathogen because it can result in serious eye infection in the infant. Shades newborn's eyes from the light. Open one eye at the time by exerting gentle pressure on the upper and lower lids. Apply ophthalmic ointment from inner to outer canthus, making sure that the tip of the medicine tube will not touch the eye of the newborn. Take the newborn vital sign. It is crucial for doctor to take newborn's vital signs because they reveal important details about the infant's general health and well-being. Monitor a newborn vital sign. Enable medical practitioner to evaluate their physiological status, spot any abnormalities or symptoms of the distress, and ensure that the proper measures are made when called for because newborn are particularly sustainable in their first few days of life. Record the procedure done and other pertinent data. A crucial component of the providing newborns with safe, efficient, and high-quality care is precise and detailed record keeping. It encourages caregiver cooperation, back evidence-based decision making, and make sure the baby best interests are at the forefront of their care strategy. Now we're going to answer related question of the procedure. Lastly, wash your hands properly to ensure health of both caregivers and the infants and aids in the prevention of the transmission of illness. That's all for today, and thank you for watching.